Hi, I'm Dr. Casey Bearden with Action Spine and Joint. Foam rolling has exploded in popularity over the past few years. No longer used by only athletes and trainers, foam rolling, or commonly called myofascial release, is now used by people at all fitness levels. This is what a foam roller looks like. It's about 18 inches long and approximately $15 at your local sporting goods department. The goal of foam rolling is to improve muscle function, increase your overall performance, and then increase your overall range of motion. When a tight muscle or trigger point is released, you're just better able to move more freely and move with less pain and just improve your overall performance pretty much in all categories. Activity, age, and injuries, for example, can all cause your muscles to lose flexibility over time, which in turn creates these adhesions or that scar tissue, and of course the result is chronic pain. And foam rolling allows you to place this deep compression on these areas, usually with your own body weight, reducing pain and adhesions while creating improved range of motion and overall flexibility. Researchers have even discovered that foam rolling during your warm-up can improve flexibility more so than static and dynamic stretching combined. So, using a foam roller on these tight muscles or trigger points has been shown to improve flexibility and just maintain overall proper movement patterns. It's very important. If you have any questions on whether foam rolling is right for you, just ask. We believe this type of at-home care is just a great way to support your adjustments that you receive at our office. And you can find pretty much many demonstrations of how to use this online. So feel free to call the office with any other questions you may have regarding foam rolling, and we look forward to seeing you soon.